Hey guys, Godfather of Anxiety again. I just wanted to make a video about my last relapse in 2020 and what can be learned from that relapse. When I went back through and thought about all of the events that preceded it, it really is no surprise that I had a relapse because there was a tremendous amount of external stress as well as some things that I had let slip and just basically a confluence of circumstance that led to, set me up for a relapse. And I wanted to make this video to give you guys something is basically a template of what not to do, right? Because I had been essentially recovered for, years, basically a decade. And, I had learned a lot of the therapy and the tools that you need to learn to be able to deal with it. But when enough things, when you neglect enough things and when there's enough external stress, even, an intelligent person will find themselves in a bad situation. So anyways, I'm just going to go through this stuff. I wrote it down just, so that you guys would get the full picture of some of the stuff that happened, because really was kind of like Murphy's Law. A lot of, external things combined with obviously, the elephant in the room, the pandemic. So this covers basically 6 months before I had my relapse. And what I did is I worked a lot of overtime. So I was working a lot. And that kind of set me up for the next couple of things that I'm going to mention. I gained a lot of weight. I gained about 40 pounds during that 6 months. At least 35. And, a lot of it was because I was working overtime. So I wasn't, I was just grabbing what I could grab. You guys know how this goes. And I really, had kind of let my diet get out of hand. A lot of the foods I talk about in some of my other videos, a lot of quick, processed, sugary foods. And, so I had that. Also, because of the overtime, I wasn't going to the gym as much. I'd be lucky if I got there once a week, maybe twice a week. And, really that's a big part of keeping me mentally sound is being able to get to the gym, being able to stay active, even if it's not in the gym. Maybe if, I still enjoy playing sports or, bicycle riding, whatever it is, those of us with these anxiety spectrum conditions, we have to stay active physically. That's going to be part of our treatment. I promise you that. And then here comes some of the Murphy's Law stuff. So I had been using a BiPAP machine for about 10 years at that point. And I get a notice in the mail basically saying that the BiPAP machine that I'd been using for about 2 years was potentially releasing particles and chemicals into my lungs. So that's not really a great thing, especially for somebody who's been battling anxiety. And so what it did is it did two things. It laid some foundational stuff for me to perseverate on as far as why I might be sick or why something bad might happen, with being poisoned here for a couple of years, at least in my mind, right? And then also, it's not like they sent me another machine. And then I was thinking, well, do I even trust that machine? So it basically made it so I stopped using a BiPAP machine as well. So that's affecting my sleep. That started to affect my sleep. Now, on top of this, I decided, I was in my late 40s. I decided, I want to try to, I had goals that I wanted to accomplish. And I wanted my full intellect to be able to do that. And so I weaned myself off both of the medications I'd taken for about 10 years, which was basically slow-acting benzodiazepine and an SSRI. So I weaned myself off of those. And when I actually did relapse, it had been about 4 months that I'd been completely off both medications. And, I weaned myself off. I wasn't an idiot about how I did it. And I did work with a mental health professional in doing it. But, especially the timing with the external stress. And then, of course, a once in 100-year event was the cherry on top. But anyways, so I'm off of my medication. So we're starting to add things up here. All the things I talk about is like the big three I'm neglecting. My sleep especially. I'm also, I've weaned myself off of medication at a time when I have a lot of external stress. Not really a smart thing to do. Then I had my yearly physical. And predictably, it was, for the first time in several years, since I'd lost weight back in 2010, it was the first time I really kind of had a bad physical. And even though, most of my markers were fine, the one that is really the most important for somebody battling their weight, I had an A1C of 6.9. Now, a lot of doctors would consider that full-blown type 2 diabetic. The doctor I was seeing at the time said he used 7 as the marker, and he wanted me to try to lose weight. So that was not good. That's not good for somebody with anxiety, somebody who's had a history of health anxiety. This was a really bad thing, and when I had that doctor's visit, it was not. That definitely got my mind turning in the wrong direction, especially since I'd been off of my, at that point, I'd probably been off for 2.5 months off of the medication that I'd been taking for, more than a decade. So then, the shutdown, the pandemic happened. So you got to remember, I know for all of you guys, it was a horrible, thing to go through. It was traumatic. And I don't think that, there may have been other times in my life when, hey, just stay home, or, which by the way, where I worked, that was not a possibility. It just was not a possibility where I work. So staying home was not an option. So that also, the fact that I had to work, especially working in a place where you basically have people from all over the country at the place that I work. So that was very stressful. And then all of the things that that all of us cling to, really, right? Like, even though I had slacked off on the gym, I still went to the gym. Well, you weren't going to the gym during the pandemic. I have a big family that I love dearly, and that was part of my routine as well. And as well as having elderly parents. So that was a non-starter. So that had to stop. There's your social connections. Everything that I use as a routine was, if not completely taken away, dramatically altered. And I know that in saying that to you guys, I'm preaching to the choir, because I know all of us, everybody was affected by that dreaded time. And, it's just especially difficult. And those who are tuned into the channel, when, we like routines. And then when we get on a good routine, it's really important for us to stay on it. And change can be scary, right? It can cause anxiety. Well, that was a level of change that in my entire life I'd never experienced all at once. even your distractions were either absent or basically absent. You know, even something silly like watching a game, right? Or anything like that. Things that I would do just to pass the time were affected or completely halted. So, you know, that's basically, those are the circumstances that set me up to have a relapse. And I'm just going to briefly, for the rest of the video, I'm just going to briefly go through what my symptoms were. Because, of course, anxiety is an ever-changing thing. And if I had had the exact same symptoms I had when I was initially diagnosed, or for the 6 years I wasn't treated, I would have recognized it pretty quickly as anxiety. But of course, that's not what happened. The first thing I started to notice, and by the way, incidentally, I don't know if some of this wasn't, you know, long COVID. I do know that, and this is something that I left out that happened right before, you know, I had my relapse. Both my daughter and my wife, separate occasions, about a month apart, had to be rushed to the hospital by ambulance. Now, at the time, my daughter was in her early 20s. Very healthy, never been, you know, I'd never even taken her really to the emergency room since she was 2. So she had an incident. Of course, looking back on it, this is right, you know, about a month. What happened with her happened about a month before the shutdown. And, you know, I just about positive it was the virus. Same thing with my wife. Hers happened right after the shutdown. But both of them had to be rushed by ambulance because, well, my wife was in basically a crisis with her blood pressure that needed immediate attention. And my daughter basically contracted. It was really strange. I'm sure you guys have symptoms that you had, you know, maybe if you caught that early on. So anyway, so that was the you know, nail in the coffin as far as getting me amped up. You know, I actually was surprisingly calm through those things, but you know, afterwards, it's kind of like I've mentioned in other videos, afterwards it was extremely stressful. So anyways, so then back to the symptoms that I had. The first symptom I had was weakness in my legs, like shakiness, like really shaky, like if my legs felt like noodles. Now, I had gotten a little heavier, but I mean, your legs aren't supposed to just stop working. And of course, when I started to get this feeling, the first thing I started to do is I lifted, even though I couldn't go to the gym, I started doing, you know, exercises at home to see if I was indeed losing strength. And I wasn't, but my legs just were shaking all the time. I started to get tingling in my limbs, arms and legs. And I noticed it especially when I laid down. It was like they fell asleep. I'm like, what's going on here? You know, I mean, I'd never had that symptom before. I'd had other strange symptoms, but I'd never had any numbness or tingling in my limbs. And that started to really scare me. I mean, you know, especially when you're in your late 40s, there's this horrible virus going around, you know. So I did what you should do. I made an appointment with my primary. He did tests. He tested my strength. Everything came back fine. You know, I had already lost about 25 pounds because, you know, as soon as I had that yearly checkup and I was close to being diabetic, that was like I was scared straight. So I had already lost about 25 pounds at that point. But I just, you know, he said everything was fine. Everything looked fine. Also, I had a huge increase in muscle twitches. And my tongue started twitching. And you know, you don't want to believe that your tongue is twitching. You want to think, okay, you know, it's just your anxiety again, just stop. And then you look in the mirror or, you know, and sure enough, your tongue is twitching. I started getting twitches all over the place. I always have them in my calves. I've had them since '08 in my calves, but I started getting twitches all over my entire body. And it was horrible. Vision changes. This is another one. The only thing I had before, obviously I had really bad dizziness, which isn't really vision, but I did get floaters when I was first diagnosed. And floaters, you know, that sounds like a small thing. It's not a small thing. I didn't know that, you know, ocular pressure can cause you to get like basically black spots in your vision that, you know, look like basically can look almost like a string in your vision. And now it gets so you can ignore it, but that was a big one for me. Anyways, I had some of those back in '03 and '04 when I first started having panic attacks. But these vision changes were different. I started to get double vision, which was scary. I also started to sometimes have tunnel vision. And I also felt like my peripheral vision wasn't as good as it should be. Really strange stuff. And I started to get, then of course, then your mind is starting, and now you're starting to realize, whatever this is, it's turning into, my anxiety's getting involved here. Groin pain and general tightness. I never had my muscles feel so tight in my life. And not in a good way. Not like in I just pumped up my muscles way. In a way where you worried if you moved too quickly, something would tear or pop. And I also had groin pain. And pretty bad groin pain. Not mild. And it ran down the inside of my thighs, and it was just really strange. Of course, I find out that that's a common one, especially in men when they're stressed out. I didn't know that. I didn't know that you would, while you're sleeping, pull yourself so tight in that protection position that you could actually cause muscle soreness, residual soreness in your groin and inner thighs. But of course I did. And I also had, not surprisingly, given the fact that I was no longer treating my sleep apnea or on the medications that I had taken, I had severe insomnia. So what this did is it turned into health anxiety. As I'm already kind of mentioning these symptoms, you guys would expect that's where it would go. I was convinced that I had ALS, and that ran into 2021. It probably was relapsed for about a year before I really started getting better. And of course, the things that helped get me better, before I get to that, so I went into health anxiety, and then after, you know, some time passed, I also became clinically depressed again. It wasn't the worst depression that I've experienced. It wasn't like I had between '03 and '09, but it was no fun. It was that thing where you start to not really be able to feel, where things don't make you excited or happy, and things that you know would. That's what's so scary about clinical depression. But so that's where I was at. Now, how did I get better? Well, I did go back on one of the medications I had weaned myself off from. I went back on the SSRI. That helped with mood stability. And then I also, I went back on the med, and I also, as the pandemic became more under control, I was able to go back to the gym. I was able to do volunteer work. I was able to do things to keep me socially, you know, I could visit. I started, you know, after some things loosened up a little, as long as I wasn't sick, I started to be able to visit some relatives again. So things started to get better, and I was able to exercise again. I started taking the medication again. And as things opened up, I also started to watch, starting in 2021, that's when I really embraced a diet change that I've still held to pretty good since then. It's predominantly a lower carbohydrate diet. I find that it helps with, me being able to stay in control and not feel so much like it's a diet where I'm watching, measuring food. And, I'm sure in a perfect world that would be a better way to do it. But this has been good. And all of my blood work at the doctor's office has been phenomenal since I've switched over to more of a ketogenic diet. I never advise people on diet because my experience has been different diets work for different people. Some diets work really well for maybe more for men, some for women, some gender isn't even a big component. The diet that works for you is going to be the one you can stick to. So this one, for the most part, as long as I mix in cheat days, I'm able to stick to. So anyways, that's how I recovered. And now just real quickly to wrap up the video, what do we learn from this? What do we learn? No matter how well recovered we think we are, no matter how much we think we understand our condition with anxiety, you are still vulnerable and susceptible to a relapse. So what do you need to do? Do not compromise your sleep. Do not compromise your diet. Do not compromise your exercise. If you're on medication, and there's a lot of external stress, guys, that's not the time to go off of the medication. Think about what's going on in your life. Pay attention to external stress. When you start adding things up, you start to realize, even before the pandemic started, I was already really upping my stress level and lowering the good stuff that I needed. So stay in your routines. If you make sure, the other thing that happened too, and this is another thing that you can learn. Because of the pandemic, my therapist changed. Also, insurance changes. So during this time, I think I went to 3 or 4 different people. And, that's not good either. You want stability when it comes to either, whether you're seeing a therapist or whether you're seeing a psychiatrist, or a lot of the times you'll see a therapist and you'll see a prescriber. Whatever the case, you want stability in that. And that was another thing. So maintain your routines. Make sure you keep your appointments. Don't feel as though, well, I'm doing good now, so I don't need to. Because life will teach you that not to be cocky, not to be arrogant when it comes to your condition. You have a predisposition. If you have been diagnosed with an anxiety spectrum disorder, whether it's generalized anxiety disorder, whether it's panic disorder, whether it's obsessive compulsive disorder, whatever it might be, if you've been diagnosed with that, you're always going to be vulnerable, always, to potentially a relapse. So don't be arrogant. Don't get cocky. Don't think I don't have to pay attention to my sleep, or it doesn't matter if there's bombs blowing up around me, or the stress is off the charts. That's not going to affect me. That's nonsense. Guys, it's nonsense. And if you're anything like me, at first it doesn't feel like it's affecting you, but it's cumulative. And eventually you get to a point where that's when you start having symptoms again. So I made the video to try to keep you guys from going through what I went through. And I look back on that when I was doing the chronology for this video, and I was looking back to see exactly what had happened. I'm like, no wonder I had a relapse. I mean, I think I kind of just blamed it on, the virus. I felt like, well, who's going to be able to manage that? It's a once in 100-year thing. But then I looked at what actually had happened, and I wrote it down, and like, I set myself up for that. I really did, by not managing the things, by not controlling the things I can control. So that's what you want to do. Keep your exercise, sleep, diet routine. Make sure you stay seeing your mental health professional. If there's a lot of external stress, that's not the time to try to wean yourself off of medication. And, just remember that respect external stress and internal stress. Because these things, life is not easy. And throughout the course of our lives, the one thing that's going to happen for sure is change. And change can be hard. So make sure you're managing your health. Make sure whether it's relaxation, whether it's prayer, make sure you stay up on those type of things as well, because it's going to be important. You're going to be able to need to decompress when times get stressful. And, if you guys stick to the therapy, you guys stick to good diet, exercise, and sleep, it's a lot less likely that you'll ever have to deal with a relapse. That's the whole point of the video. Just arm yourself with information, learn from my mistakes. I know I'm gonna. I don't plan on letting that ever happen again. And, it's just really important that you stay proactive. It's so easy to get lax, but it won't work out well. So that's about all I wanted to say in the video. Thank you guys so much for the engagement with the channel. I'm grateful for it. Thank you for all the comments. Keep them coming. Like, share, subscribe. Tell any friends you have who are experiencing anxiety, or any relatives, or if it's you. I have a lot of videos now. You'll get to see what I've been through, and also the tricks that I've learned to help keep things under control. And anyways, thank you guys so much. And until my next video, take care.